say the hardest moment was having to put a breathing tube in my patient who could no longer breathe for herself. And after the breathing tube went in, we called the family, and the husband, of course, couldn't visit her because of visitor restrictions at the hospital. So I had to put him on a phone and hold the phone to her ear as he told her that he loved her so much. And then I had to wipe away her tears because she was crying. One of the hardest moments was having to see a family member of a COVID patient say goodbye over an iPad rooms away. That was a tough one. I can't imagine how hard it would be to be saying goodbye and you can't see your loved one and then they're gone.
It's hard. It's hard in lots of ways. Since it's a new virus, we don't have any experience with it. For most diseases, I'm used to seeing it and taking care of it, and this, I don't have any starting place. I know what I'm hearing from New York. I've read all of the papers, it seems like, but no one knows what the correct answers are, so there's a huge amount of uncertainty, and people are really, really sick.
I had a patient fall out of bed today, and I had to call his wife and tell her, and she couldn't come see him, even though she pleaded and begged to come see him.
Seeing these new moms have babies has been the hardest moment, along with having to breastfeed them, do their pumping for the new moms, and them not being able to be with their newborn children. It's hard to think of the family that they're missing.
Thinking about all the stories that these patients presented last night is like make you think about the virus does not affect just the elderly people. It also affects everybody. It affects an athlete, a strong person without any comorbidities. It can affect anybody. So it was kind of like you just have to pause and think about the spread is really in the community, and it can affect anybody in all walks of life.
The hardest thing in all of this has been taking care of fellow healthcare providers. It's really hits home, and it's really scary when you see someone that could be you coming in and now you're taking care of them. It's also hitting home that once healthcare providers start getting sick, who is going to be taking care of the public?
The hardest moment of my shift today, I was in charge, and we had a really sick patient that was in a really, really small room. And usually when we have sick crashing patients, we can have a ton of resources and a ton of staff go in and help with the nurse and the doctors that are taking care of that patient. But due to the patient being ruled out for the coronavirus, we could only have 5 or 6 people in the room at a time, and putting on all of the gowns and gloves and masks and face shields to protect us in case the patient does have coronavirus, it takes a while. So the nurse that was in there ended up being in the room for 6-7 hours with minimal breaks, and it was hard being in charge and knowing that she was stuck in the room and really nothing I could do to help her.
I think the hardest moment has been the fear that lives within all of us. There's a lot of unknown right now. We fear what's going to happen tomorrow, how the emergency department will look next week when we come in. We have fears about our own colleagues, whether they will fall ill. We also fear that we could be asymptomatic carriers and bring this virus home to our families and our loved ones. There's been a lot of fear over supplies and whether we'll run out. And then obviously there's a fear that we will see patients and not be able to do everything we normally can to help save patients' lives.
For me, the hardest moment was a young woman who died and her family wasn't able to be here with her.
The hardest moment during the shift was just seeing these COVID patients die helpless and without their family members beside them.
Help treating this virus is terrifying, to say the least. I work in a surgical ICU, so I'm used to seeing very sick patients and I'm used to patients dying, but nothing quite like this. It's in the flip of a switch, without the support, they're completely isolated. They're very sick. Some of them recover and some of them don't. But the hardest part, I would think, is them having to go through this feeling like they're alone.
My team has been really great to me. We've worked really well together and we've really come together in this crisis, and we don't really know each other. We all come from different units within the same hospital, so for us to come together and work so well, like as a team, it's been a journey, but I think that's what is giving me hope.
It's very stressful. Everyone is on edge. We don't know who's coming in next or how sick they're going to be or if we're going to get a whole bunch of people or we're going to get no one. It's a really stressful and just completely unusual time for all of us.
I'm used to treating sick patients. I treat sick patients all the time. It's very different knowing that the patient you're treating is actually a risk to you as well. That's the main difference here.
It's tough. It's tough to see families or patients with no families. You're the only source of human contact that they have.
The message I would give the world would be to check in on your friends and family, make sure they're okay, take this seriously, and to tell everyone that you love them, because you never